just to remind you that we're looking for really feedback on two big questions. What are the barriers in introducing the technologies that you've been talking about in the sessions in Kent, and what can be done about overcoming those barriers as a quick win? How can we get some of these things beginning to be deployed ASAP? So those are the two questions. And I'll go through the list in the order that I have it here. So maybe if we could start with online volunteering.
I'm just rewriting the notes in the yes, right. We're just quickly rewriting the notes that I've made from the group and the two headings that you just said. Hope you'll bear with me. Barriers with volunteering are mostly around mindset and culture. So people traditionally think about volunteering as charity shops or time spent actively in that way. And also businesses, the way they think about employee volunteering in terms of dashing down to the local town parish hall and repainting it, that kind of thing. So what can be done differently is quite a lot. Quite a lot of suggestions around changing the culture. For example, within a CCG, considering implementing employee volunteering from the outset. Volunteering, volunteering as a team for employees to think about bookending. Employee volunteering the lunchtime to call somebody who's isolated and lonely. This could be including into existing befriending programs. Just generally work volunteering anyway. Somebody said that they never thought they could volunteer because they work. Now they know they can. We found a brand new resource called streetlife.com, which is very good. We talked about logging in with Facebook into sites, how if you log in to join something new with your Facebook site, it immediately opens the network out much wider. A couple of volunteer centres said they would be approaching their organisations to talk about more flexible types of volunteer opportunities. Somebody said great ideas on how to visualise, lay out things simply. New ways of linking with businesses in terms of volunteering, and just generally making websites more accessible.
That was absolutely fantastic. If everybody could keep to a similar amount of time, we'll be on course to hit the tea break at the right moment. So that was both incredibly succinct and also beautifully well timed. Thank you very much. The next one then is residential care and supported housing. I'm looking for...
That's Mike.
Ah, Mike.
Thank you, James. Barriers are around cost, people working together, the sort of lack of integration of services, how information is shared, the lack of directories and resources that people can go to maybe as one-stop shops. Lots of good examples of things that do work, are working, whether it's Skyping information between people, whether it's joining up families, whether it's online dating, plenty of good examples there. So if we can gather that information together from across the residential care and care home sector, from the supported housing sector, if we can gather that information together and network the experts, I think we've got some good opportunities there for overcoming some of those barriers. Thank you.
Fantastic, thanks Mike. The next one I've got here is e-mental health.
Sarah and Mark, wasn't it? Sarah, Mark, either or both?
Someone give them the 5-minute warning. They might still be busy.
Okay, I'll go on to the next one. I'll leave them till last, and we can come back if they're here. Digital inclusion.
That's clear.
Hello. We talked about digital inclusion and about a project that Kent County Council Library Service are implementing involving issuing people with the loan of an iPad and a tech buddy. They also do IT buddies actually in the libraries to help you learn some tech. We found that the digital inclusion barriers that we identified fit into 4 categories. Technical skills, like we don't know if a mobile version is the right one, training in digital skills, financial barriers and money to access the kit that we need. Personal skills like confidence, knowing which tools to use to manage a long-term condition, and resistance to change that have to be addressed. Community issues, which was about how to use these tools in an asset-based approach, how to think about excluded groups, people that are disconnected, people with chaotic lives, and also about kind of utility issues like broadband connectivity and penetration of different devices. And finally, service issues, which we thought was the biggest section overall actually in terms of barriers. We felt that we could actually make some changes in this area if we focused some effort. There was some talk about workforce issues, staff levels of knowledge around digital inclusion and the actual digital inclusion of staff. We felt that that was a really important issue for management to address. Also around the services that can be barriers to people that are using digital technology, or services that don't talk to or share information with, digital applications and services that people want to use, making use of the quantified self, the fact that we've got these big social drivers like digital by default and digital by design, and the fact that there might be a small number of people for whom technology isn't the solution and that services have to continue to provide alternatives even though they're digital by default.
Fantastic, thanks. Okay, and I have next on my list supporting carers and families.
Okay, thank you. We had 2 really exciting and fast-paced workshops for looking at issues for carers and families, and an ad hoc issues workshop at lunchtime as well. So we've had 3 workshops really, and I think the key themes are so consistent. What are people saying? Bureaucracy gets in the way, totally. So you've got local people who want local tailored solutions, and it's not a case of having more information, it's a case of having what is there out there for me at the moment with this often crisis or problem that I've got, and for people to be able to quickly find out local solutions, very local solutions. So that was a very key theme. Technology is part of the solution, but not all of it, because they didn't want to be left without the human contact. Affordability was a big issue for technology. So I think iPads people think are a really exciting way of, particularly older people, perhaps engaging with technology who'd otherwise be excluded. But where do they find the money to buy some of these solutions? Some of that could be solved by people knowing their entitlements more. People don't necessarily know what benefits they're entitled to, and that might even buy them an iPad. We had, I think they're probably the key things that came through with this, Stuart. Is there anything I've missed?
A lot of people just bypassing the bureaucracy themselves.
Yeah, I was going to say about the creative.
Oh yeah, and lots of creative use of existing technologies. Some interesting uses of Facebook, making private Facebook groups instead of using bespoke solutions, using Twitter and email in interesting ways.
Yeah, and I think I was looking at whether I've missed anything in terms of the kind of problems that people saw, but as Stu says, some really creative ways of people resolving problems. And at Facebook, for people who've perhaps got an elderly relative in a care home or in a club and they're at a distance, I can think of the Healthy Living Group, Healthy Living Club in London, doing fantastic things, linking their community with families at home, and a very good examples locally here in Kent. I think another example that came up from Jill, who's a local person who came onto our group, was talking about intergenerational work. And if you can get young people in schools and sixth form colleges using technology to bring some of the older people on board with things that they wouldn't otherwise engage with, so even people who haven't got their own families and so on can take part. And I think that was pretty much it from... sorry, thank you. Something that I'm really passionate about, I'm involved with a group called Dementia Challenges on Twitter, and someone I know has just basically met a gap. She's a carer herself for a mother with dementia, and she's set up a fantastic website called dementiachallenges.com, and literally it's carers sourcing solutions for other carers. So whereas dementia information might be very medicalised so often, that's not what people want. They want to know, I want to take my mother with dementia on holiday, or perhaps she goes to the local shop and one of the assistants there is really supportive, but the other people are too impatient with her. And people, peer support, offering each other fantastic practical information. The site's just growing and growing with crowdsourced, and I think that's a big thing with digital technology, crowdsourced solutions, peer support from the people you know. Won't take long.
Fantastic, thank you very much. Yeah, okay. On my list next is online marketplaces.
Hello there. We were looking at online marketplaces and some of the barriers that people are finding when they're trying to access all sorts of different things in them. So services, products, all the different things that could be accessed online. And one of the things that kept reoccurring was that actually for products especially, there was a big barrier in that a lot of them were on approved sort of supplier lists and people couldn't shop around for different alternatives. We identified that there are lots of different things out there, like environmental controls you get from B&Q, as well as all the possum and seeker stuff that's out there. But OTs are finding it very hard to actually say that they can go with this because it's not on an approved supplier list. So looking at those sort of things was key. We also had a look at the provisioning of services as well, and how people are finding there isn't a sort of directory of all the other things that are out there on the internet. And it's a case of just Googling for whatever it is that you might need rather than turning to an overarching directory of stuff. And the directories that are available are full of sort of cream boxes and plastic, not very sexy equipment and services that a lot of disabled people that are now becoming consumers rather than just users aren't really happy with, and they want better technology and they want nicer things in their houses. They don't want the big standard cream boxes that you always get. So it was a lot in our sessions about looking at pushing things forward and making everything a lot more accessible than it is now.
Great, thanks. Okay, the next is community connections.
We were talking about community connectedness, and I had to declare early on my own fear of technology and complete technophobia as one of the obstacles coming from professionals who are trying to commission services in the community. We also talked about attitudes towards older people, our views that they can't use tech, but also that not enough are using tech to make it worth investment. Poor quality of information and misdirection from websites, and the difficulty in Kent particularly about access to the broadband, which often goes down or isn't available at all, and access for deprived people because of the cost of technology. We talked about the speed of change and how whatever you procure, by the time you actually get it into place, it's out of date, and the barriers that government legislation, information governance have as a barrier to procurement. And the culture of organisations that we have traditionally done things for people, and how we've got to shift that thinking to become enablers rather than doers ourselves. As organisations, we don't want to take risks, and we've got to find other ways to deliver services. So, I think it was Dominic's strapline, which is we've got to stop saying no and start saying how. We need to enable communities to do more, And trusting those communities to have the resilience and capability, and we talk particularly about those in the 50s and 60s age brackets, supporting those who are maybe older with their technical support at home. We talked about trusting in our providers for people who, like me, are trying to commission things they don't understand, to have loose specifications and not to over-specify. We talked about dementia-friendly communities and the work we're doing there to connect our communities up.
People, service users, carers, their relatives, and anyone involved in social care to actually have the power to publish their stories about their experiences in social care. We had a really good discussion of this as an important and quite a relevant timely case study, not least because some of the public policy drivers like Francis Inquiry, Sittingbourne, which is at the forefront of our minds, looking at, the order of the day seems to be looking at how we actually listen to users of our services, health or social services. And one of the things that we thought, actually, if not now, if we couldn't have a technological revolution in user engagement now, then when could we have it really? We looked at the barriers. The sheer size of Kent, we thought it might be a little bit tricky to get sign-up as quickly as we would want. We looked at the issue of service providers and would they be on board, how receptive would they be to this. In the solutions, we looked at, we set up a care opinion meeting with Commissioners Emma and Joanne to look at, we've got a date in the diary to look at how we can spark off a technical revolution in social care user engagement in Kent. So, we're working in that right direction. But there were so many good contributions from my group. I just wondered if I'd missed anything and anyone wanted to add anything. Okay, I'll leave it there. Thank you.
Fantastic. Okay, and finally, we can come to the mental health. I don't know which one of you wants to. Okay.
Thank you. So, myself and Mark, who has kindly batted back to me, we're talking about e-mental health, so looking at the use of information technology in mental health specifically. Mark has done some amazing work with Innovation Labs to develop Doc Ready, which is an app to help young people be able to access GPs or explain to GPs what it is that they're concerned about so that they can access healthcare. And I have been working with the Early Intervention and Psychosis Service in Surrey to develop an app to help people with psychosis manage their mental health. Some of the discussions were about, obviously, the need to understand what the need is to begin with. So the apps are not the solution necessarily for our populations or the people that we work with. It is something that they said that they would find helpful, but that does not mean that it applies to everyone. I think what we both agreed on was that we need to give people choice. So those who would find this sort of technology useful need to be given that choice to use it, to maintain their well-being and to reach their aspirations. We also talked about the fact that there's about 200,000 health apps already available, so it's really hard to know what's actually safe, useful, and what isn't. The promising thing that I'm aware of, which should be taking form this year, is the first UK mental health strategy, which starts off with a gap analysis to understand what's already available and where the gaps are in this sort of technology. And I think that would help people to know, what they can do in their local areas or whether they need to do anything if a solution already exists. So I think that's the general gist, unless Mark wants to add anything.
I'm all right. Was there anyone else who's in our session who's got any thoughts at all? No?
Okay, that's brilliant. I mean, I've done so many of these plenary sessions over the years where I've been desperately trying to stop people from talking too long. Nobody ever seems to take any notice of 2 minutes, but you've all done absolutely brilliantly. We're going to have an opportunity for asking questions in the panel session that will be after the tea break, so I don't particularly want to keep everybody here any longer. I just wanted to add my own reflection from going around and visiting various of the workshop sessions, which is how incredibly interesting it was to see here is an area of social care where there seems to be so much optimism and enthusiasm. And I think I'm particularly struck because over the years I've often had to listen to people complaining about lack of funding, and now we seem to be in the most acute lack of funding there's ever been, and yet people are more optimistic than ever about some of the things we've been talking about, and I just think that's extremely interesting and very encouraging. Maybe some of this is actually driving some of the changes that should have been happening years ago. Anyway, I think tea is probably ready now, and if we could reassemble here at...
It's 3:30.
At 3:30 for the panel session. Thank you very much.